Let's learn a little bit about HIV/AIDS, the sneaky retrovirus. HIV comes from the genus Lentivirus under the umbrella of a retrovirus. And remember that a virus is a non-cellular pathogen which cannot replicate without a living host. This is what HIV looks like under a microscope. And let's dive into the history of how HIV was discovered because it is interesting. So, AIDS was first suspected to exist in five young gay men that were otherwise healthy who passed away from unusual pneumonia. This was reported by the CDC in 1981. There were clusters of gay men that were dying from opportunistic infections, and it was puzzling the doctors at the time. This was so unusual that the New York Times published a paper calling the new discovered illness as a rare cancer found in homosexuals. It wasn't until 3 years later, in 1984, that Dr. Robert Gallo was able to isolate the cause of the AIDS illness. He discovered a retrovirus as the cause of the AIDS, which they named HTLV 3, more commonly known today as HIV. Okay, so who does HIV affect? Um, of course, us human beings, which is why we're so interested in it, and uh, certain species of primates. Okay, how does HIV spread? HIV is a blood-borne pathogen. If any part of the mucus layer is exposed to HIV infected bodily fluids, you're at high risk of getting an infection. Risky behavior that exposes you to HIV include unprotected sex, sharing needles, coming into contact with contaminated blood, and any of the activities listed here on the left. Now, let's learn a little on how the virus um, works once it gets inside the body. So, HIV, what HIV does is that it seeks out your T helper cells, these red cells right here on the left, um, because they have a receptor that they like to bind to, which is called CD4. Um, and I'll show you what it looks like in a second. Right here. If you can see the CD4 receptor on the top left, and that's the HIV virus binding onto it right there. So once HIV binds to the CD4 receptors, HIV has a single strand of RNA which forms into DNA once inside. HIV binds itself into the nucleus of the T cell, and from the nucleus, it will create more copies of itself and spread like little minions. The T helper cell will keep producing HIV replicas until it dies. This will eventually cause you to have low T helper cells, which will hinder your ability to fight off opportunistic infection. If left untreated, this will lead to certain death as we need our immune system to survive. So, this is a map of HIV related deaths. This is from the uh, global burden disease. So, what this shows you, this doesn't show you, well, the areas that are more affected are, as you can see, South Africa, Asia, um, parts of Southern America. Um, but these are HIV related deaths. So you got to keep in mind that a lot of these areas don't have the resources to treat it. Right? It doesn't mean that there's a higher concentration of HIV in those areas. So here we have the World Health Organization. So according to the WHO, There was an increase in the total number of people living with HIV from 2010 to 2022. The total number infected rose from 31,500,000 to 39 million. Even with all that we've been through with the disease, we are still failing in the overall spread of the disease in countries with less resources. So now let's look into the symptomology, or how the virus will present itself if, God forbid, you get infected. So HIV infections are generally asymptomatic until years after the more severe recognizable symptoms appear, you know, after infection. So typically you'll have a 40 to 90% of cases. Initial infection will cause a fever 2 to 6 weeks after infection. And we tend to separate HIV into four stages, which we'll go into in a second. So stage one is asymptomatic. So you could have the virus uh, and active have an active HIV infection without knowing it for a very long time, because you won't have any symptoms until those CD4 cells that we talked about, the T helper cells, until they start dropping, and your body can't fight off an infection. So what's going to happen in stage two? Now those CD4 cells are starting to drop, right? So your body can't really fight infections as well. So what you'll get is weight loss, and you'll get reoccurring respiratory infections that are unusual. Okay, now we move on to stage three. Now you'll have oral candida, which is fungus growing in your pharynx or in your mouth. You'll have more severe bacterial infections, and you'll have unexplained fevers, right? And all of these things you'll have all these diseases or all these bacteria and fungi growing because the CD4 T helper cells that usually fight off the infection is low, and they can't control these infections in your body. And stage four, you'll get a pneumonia, cerebrotoxoplasmosis, esophageal candida, so the fungus will move down to your esophagus, and a lot more things. And eventually, you're not going to be able to survive, and you'll die. So once a carrier, you're always going to be a carrier, unfortunately. Once infected with HIV, the person will become a carrier and will continue to carry the virus for life. The good news is, with current medicine, your viral load can be so low that you can test negative for HIV. However, HIV has been very challenging for virologists to cure because of the virus' latent ability, among many others. The virus is able to stay dormant inside of the patient's uh, T cells and replicate at a later stage. Now it's a good time to show this picture. This is what I mean by the HIV's latent ability. So as you can see, step one, um, your cells, these are normal cells. Step two, now your CD4 T helper cells are infected with HIV. Now, um, let's say you initiate art therapy, which we'll get into, which is the medicine. So all the gray cells right here are dead in HIV infected cells, but then you'll have this one that stays behind. That's the latent ability. And then from that one, you'll go to number four, which is now we got a whole bunch of them, right? And that's why it's so hard to get rid of the virus. Now, the other stages to the right, those are more like ideally, yeah, um, you can do a cocktail and all these fancy treatments, and but it'll never get to zero. If the count can get to zero, then you wouldn't get reinfected. But it's been very hard to get it to zero. Okay, so these are the current HIV meds. I'm not gonna name them all, but I will tell you that some of these pills are once a day. Most of them are once a day. Some of them are longer lasting injections, which is once a month. Um, and some of them are a combination of both. This now we're gonna go into the latest technology on trying to combat the virus. So this is called the CAR T cell approach. CAR T cell therapy focuses on altering the genome of the T helper cells in order to train them to seek out the HIV virus or HIV infected cells and destroy them. Studies are currently being performed in this. All right, so these are international efforts that are being made by the Global HIV Prevention Coalition, which was established in 2017 with the mission of eradicating HIV by 2030. The coalition, of course, focuses on regions that are low resource and more affected by the HIV virus. Um, and how do you protect yourself? Well, you stay away from risky activities, like we mentioned earlier, unprotected sex, sharing needles, um, coming into contact with bodily fluids is probably a good idea to do. Um, and just remember, we if we educate each other, then and everybody's educated on the disease, then we're gonna stop the spread of it. Okay, thank you for listening. I hope you enjoyed the lesson.